All right. So an important module that we have to go through is first aid. Okay. So while we're going through those more theory kind of module, we still have to do the practical one. We had already went through vital signs. Now we have to go through first aid. Okay. Ryan, you can scroll down. Okay. Scroll down a bit. All right. So some definitions there. First aid, the emergency care and treatment of a sick or injured person before professional medical services are obtained. And then you have diagnosis. Diagnosis is the identification of a disease, and you identify the disease based on the symptoms and signs of the person who is ill. All right. And then you have casualty, a person or care recipient who is injured in an accident or who has been fallen ill and in need of emergency medical care. So just ensure that you know those definitions, or you can recognize those definitions, right? So first thing to note for first aid is ABCs, airway, breathing, circulation. Just like when we had our primary survey, right, that we were discussing earlier last time. So checking airway, make sure that there's no obstruction to the airway. Also checking for breathing. Okay. And how do we check for breathing? Anybody? Guys, remember this, how do we check for breathing? So I'm not sure if I'm speaking. How do we check for breathing?
I don't know if I can chime in.
Okay, go ahead.
So the two ones you can work with is like first is see if their chest is rising and falling at the normal rate.
Right.
It's like outward expansion,
Right.
inward folding.
Well, that's all you just check for. You just check for rise and
Yeah.
fall of the chest, right? And if there's
Mhm.
rise and fall of the chest, then you check for the respiratory rate, right?
Right.
And we already discussed how you would check for respiratory rate already.
Mhm.
And we said what you do is you look at the clock
Mhm.
for 30 seconds, right?
Mhm.
Okay. And then what do you do? So you look at the clock at a point, so you can start from like maybe the 12 and you wait until it reaches the 6, which would be 30 seconds, right?
Right.
And during that time, you are looking at the person's chest and you're seeing how many times they take a deep breath in and out.
Right.
Each breath would be an in and out.
Mhm.
So it's not in and then one and then out then two. Is in and out is one, right? And you count
Right.
how many of that you get in the 30 seconds, and then you would multiply it by two,
So.
right? Because you have two sets of 30 in 60, right?
Right. Right.
Right. So if in 30 seconds you get 9 breaths, it means that per minute it would be 18 breaths per minute, which is normal, right?
Yeah.
Right. And then circulation. How do we check for circulation? Anybody? I want to hear somebody else apart from Ryan. How do we check for circulation? me see who is online today. Andrea? Andrea Rose? Hello? Let me see. Colette?
We could check for circulation by feeling the body temperature. If it's warm or cold.
No man, circulation would be blood flow. Blood flow. So how would we check for blood flow?
Right, so I'm saying that you could check the temperature of the body to see if the blood is flowing.
Hold on. All right, so the temperature would
So for example,
hold on, somebody's thing. Okay, go again.
I'm saying that for circulation checks, you could check, for example, if blood flow is not happening in the legs, it would probably be cold.
Right. Well,
right.
that would be more of a symptom, right? Meaning what the person would complain of. But what would you check for in circulation? Remember pulse, right? Pulse.
Okay.
Right. So you would check the just like what you see them doing in the movie where they put their hand on the person's neck.
Right.
They're checking for the pulse. Understand, Colette?
Yes, sir.
Right. So you would check the pulse right there. You would check the pulse on the hand. That is how you check for circulation. So you check for circulation by checking the pulse in the neck. And you check for circulation by checking the pulse in the hand. Right? And we check for breathing. How we check for breathing would be rise and fall of the chest and the respiratory rate. Okay? I will already say, oh, we will check for the airway already, which would be looking in the mouth or the throat to see if there's anything obstructing the airway. All right? All right, so in first aid, priority is given to minimize bleeding. So once you have bleeding, that is the major priority over everything else, really, okay? So you try to stop the bleeding as quickly as possible. If you don't stop the bleeding, then the person can die, okay? Especially if it's severe bleeding, all right? All right, you can scroll down, Brian. Okay. First aid that you may require to deliver can include bleeding control, spinal cord care, basic patient management, stabilizing fractures, cardiopulmonary resuscitation or CPR. So those are the things that you would be able to assist with when you're a medical assistant, right? You're supposed to help to control the bleeding. You're supposed to help with spinal cord injury care or spinal care. You're supposed to also assist with basic patient management, stabilization of fractures, and in cardiopulmonary resuscitation or CPR. Okay? And they are going to be further discussed in element 3. Now, how do you perform, or what are some of the things that the first aid involves? Assessing the situation. So you check the situation and see if it is a harmful situation or if it's a situation whereby you can work, right? Because remember, your safety comes first. Okay. Identify appropriate control measures. So for each of the things that we discussed above just now, like bleeding, spinal cord, stabilizing fraction, CPR, you would want to identify the measures that are in place in order to do them. Awareness of emergency services, responsibility and responsiveness. So you have to have access to ambulance, right? Know the ambulance numbers, those kind of things, right? Treating injury and then maintaining the equipment. Scroll down for me. These casualties may include, or up. These casualties may include infants. I remember infants would be considered 0 to 12. Children would be 1 to 8. And they put adults as 8 and older, right? In the case that why they say that you would treat them as an adult, even though they're 8, the procedures that you would do for an adult is the same procedure you would do for an 8-year-old. Do you understand? So whatever type of health, whatever type of first aid you're going to do for an adult is the same thing you would do for an 8-year-old or and up. All right. So if you don't do that, then by law you didn't do the thing properly, right? It says systems of the body that you should be aware of, and we discussed most of those already, but we will go through them as you go along through the practice papers. Anything that you're not familiar with, you will definitely be able to get through. So don't worry about this whole stuff that we're going. It's the same thing going to be repeating over and over and over again. All right. You should know the law of the land and and what is actually applicable to the place where you're working and the policies and guidelines that support your workplace. All right. Can scroll down. All right, and you can go through these on your own. Scroll down. Okay, stop. You can stop, go up. All right. It says, ask your supervisor or nurse or learning facilitator to arrange and conduct a lecture discussion on the different systems of the body. I believe we went through this already, remember? The only one that we didn't go through is skin. All right, so I'm going to forward back those videos when we finish. The one on respiratory system, skeletal, digestive, circulatory. All right. I believe we didn't go through skeletal and skin. We went through the rest. All right, scroll up. All right, so we're now going to look at the different aspects, right? So the first one is make an initial assessment. Okay. And so the purpose of first aid is to one, save life, prevent further injury, minimize or prevent infection, and promote recovery. Okay, they want to one, save life, prevent further injury, minimize or prevent infection, and promote recovery. Okay, it says the initial assessment or collection of complete, factual, accurate, and relevant data of a casualty is critical to the outcome of the life-saving situation. This will help you to determine the nature and extent of first aid assistance that is required. You may do so by observation, interviewing the casualty, if possible, from eyewitness reports and examination. Be sure to take the time to do a thorough assessment. All right, so scroll down. So during the assessment, these are the things that you're going to look for, right? The safety. Remember I said that? I said, is the place safe? So that's the first thing. Is it safe for you and for the patient? Does the casualty need to be moved quickly to a more safe environment? The next thing is cause and extent of the injury. What caused the injury? Is there danger or further injury? And can the hazard be removed? How bad is the injury? So you're checking to see how bad is the injury. Basically, that's it. And whether or not something is there that is going to cause further injury. So because of that, you would want to remove that. Okay. Next thing that you have to assess is consciousness. All right. You want to find out the person's level of consciousness. And the ways that you can check this is one, you can pinch their earlobe or you can pinch their toe. That's for the infant to determine their pain, right? And in adults, anybody know how you can check the consciousness for an adult?
If they remember like basic information about themselves.
Well, that is true. Very good. And what else? What can you do? Suppose a person is unconscious. What can you do to see if you could determine if the person is just, you know, if the person is faking or if the person is definitely unconscious? What could you do? You ever see anybody do anything? It's called a sternal rub. Have you ever heard of a sternal rub before?
Yes, yes.
Anybody ever seen a sternal rub?
I have.
Let me $100.
Right. So it's like you rub the center of the person's chest with your knuckles. And if the person is faking, the person will definitely jump up. Understand? As it's excruciatingly painful. If the person is unconscious, then they're gonna still remain unconscious. Okay. And then number of casualties. You want to see how many serious injuries are going on, right? Then your medical alert and history. The medical alert would be, you would call like for help, call for the ambulance, call for the emergency contact sheet. That's what they call it, okay? But they say that they're gonna show you a sample of the emergency contact sheet, okay? It says seek help from bystanders, so persons who are not sick and can assist you, then you would want them to come in and help. You would call for them and say, hey, can you come and help us to move this person because it's a mass casualty, okay? Or if it's a case where it's just one person, then that's fine. And you also need to seek permission. Ask the person or casualty if it's okay for you to perform the first aid on him. Explain that you are trained to do so. If it's a child that is unconscious, you just have to go straight ahead and do it unless the parent is there, okay? I think that is clear for everybody. Is that clear for everybody? Kind of straightforward. Everybody got that? Okay, all right, cool. So scroll down. All right, stop. So that's the emergency contact sheet. And you're not gonna try to fill out everything, but certain things are definitely important, right? You want maybe a family contact. So you probably just need maybe just one emergency contact number. And you would also want to know their blood type, if there are allergies, if they have any medical conditions. Okay. All right, scroll down. So now we look at the first aid kit, and the things in the first aid kit would be Band-Aid, bandages, we have crepe and roller and triangle. And you have gauze and you have cotton wool swabs and pads, right? Children's aspirin or Pephanol, Savlon. Savlon is a cleaning agent, Dettol, antiseptic ointment, disposable gloves, rubbing alcohol, smelling salt, thermometer, and scissors. Okay? And there you are. Okay, the verse aid kit. Okay, scroll down. Remember, before you do anything on anybody, you ask them for permission. All right, stop. This is role play the following situation. Several children are sitting in a tree playing and watching a football match on the other side of the fence. A limb broke and children are scattered on the ground in various stages of shock and injury. Do a quick inspection of the scene, interview eyewitness and or casualty, assess the situation and take charge of the scene, decide which injury should receive priority attention, summon medical assistant and emergency service, and initiate first aid action. So you see that is that right there is the order in which you should do things. Okay? So you do an assessment of the area to see if it is safe. Okay? You get some information from the persons, especially you would be using the emergency contact sheet. And at that point in time, you would determine which casualties would be priority versus which would not be a priority. Okay? And then you would call for help. By always call for help, persons to help you. And then before you initiate, oh, hold on. Before you initiate anything, before you do anything on anybody, you should ask them for their permission before you initiate the first aid action. All right? So that's the order. Okay. All right. Yes, Ryan, you can scroll down. Stop. All right, so right here now, report initial assessment to personnel or emergency services. So remember, you're supposed to not just do everything on your own, you're supposed to report it to the persons who are in charge or the emergency department, right? So following the initial assessment, you are required to report the results. You are to report the illness or injury to the designated personnel and write a report to the health log or according to the requirements of the facility and summon emergency services immediately. Okay? Designated or specially authorized personnel in this case may include the following: healthcare assistant, nurse, first aid attendant, specific or specified occupational health and safety personnel, other persons authorized or nominated by the workplace to perform, approve, inspect, and direct specified work. So depending on the nature of the emergency services may include the support by the ambulance, the police, the fire brigade, okay? It says the emergency team, after being appraised of your finding, will then give you some instruction, okay? So one, you look at the situation, make sure it's safe, you make sure you get certain things in place, right? But then you report it to the person who are considered the emergency service, okay? So either the doctors or the nurses or the hospital. And then after you do that now, they might dispatch somebody that might assist, like the police or the fire brigade or an ambulance to come and assist you at the scene. All right. All right, you can scroll down. All right.
Sure.
Hold on. Somebody needs to mute. Ryan, you could mute those two persons, please. All right, so element 2 now. Element 2 looks at ensuring the safety of patient and care. All right, scroll down. So scroll up. The first thing you're supposed to do, comfort and reassure the patient. All right. So your first responsibility is to offer comfort and reassurance to the ill or injured person to calm his or her fear and prevent panic. So when somebody is panicking, it makes the situation worse, okay? At the same time, you must take steps to ensure that the patient is not exposed to the danger or further injury or aggravation of the injury sustained. You should put them to lie down comfortably, all right? All right, scroll up. Hold on, it says you can roll him or her to the side, position the top leg to balance him in the side, right? So that you don't have them rolling over onto their face, right? Tilting the head in a neutral position to keep the airway open. And we're gonna go through these a bit more in detail, right? But they're just kind of giving you an idea as to what you should do. It says you should try to reassure the patient before you start treating the problem and keep him or her constantly reassured by your words, manner, and action. Scroll down. So it says list of suggestions for keeping casualty comfortable, reassured from further injury. So 1, by word, by manner, and by action. So by word, you tell him or her that you are here to help him or her feel better and that you will stay until the nurse or doctor arrive. Second thing that you can do, tell him or her that the doctor or nurse will arrive soon, right? And that nothing will happen to him or her, right? In terms of telling him that the help is on the way, it says be calm and confident so that the patient can be calm and confident as well. And place the patient to lie gently on the flat surface, bed or stretcher with exception, and examine injury. So if you're going to be panicky, then the person going to get panic as well. In terms of the part where it says, tell the doctor, tell him or her that the doctor will arrive soon and nothing will happen to him or her before then. You have to be gentle, sure, and unhurried. And you loose tight clothes so that the patient can feel comfortable. If necessary, cut the seams to loosen or to make you better able to examine the injury. So sometimes what you have to do, you have to cut through the pants, cut through the skirt, right? And open up the area so that you can see if there's any cuts, right? Next thing, ask the patient if your actions have made him or her more comfortable and if he or she feels cold. If wounded, tell him or her that you are going to clean the wound and that it might hurt a little for a short while. It says, be firm in your actions and work quickly so that any discomfort will be short-lived. And it also says here, ensure that the patient does not develop a chill, but that enough clothing is removed to allow you to examine and clean the wound. It's basically common sense, some of these, right? If he wants to see the wound more, you go cut open the clothes. Him can't go take off him pants. Him can't go. She can't go take off her skirt or anything. So she's gonna need your help to remove the clothes or to expose the clothes. So, and then they have an injury, so you can't move the leg, you can't let them sit up. So what you'd have to do is typically cut off the clothes, right? If bones are broken, tell the patient that you are going to apply a splint so that it stays into place and does not break further. And then work efficiently. Do not be distracted by any undue screaming. Splint the broken leg. And we're going to show you how to splint a leg or splint a broken limb, right? Encourage the patient to be brave and reassure him or her that everything will be all right. Smile reassuringly and continue to keep the patient sterile and warm. If no professional help is required or immediately forthcoming, place the patient gently on stretcher and remove to own bed with the feet first. All right? All right, scroll down. Can scroll. Scroll down. That's another role play that they had there. Scroll up, let me see. The role play. All right, so it says role play two contrasting situations involving ill or injured persons who receive or do not receive adequate emotional support from their carers and the impact of this on their condition. It says critique the attitudes of carer and assess their sustainability for these aspects of the role. Offer constructive feedback. Now, basically, everybody has different personalities, right? As such, it's better for you to follow a structure so that you don't make your own personality or your own feelings impact how you do your job, right? So just like what we went through that table, it's best for you to do it just like what is in the table. And remember, we're focusing on how to make persons comfortable or to prevent further harm. All right. All right, scroll. You have to maintain hygiene, and we already know about hygiene. You're supposed to wash your hands, and it's considered single most effective means of protection. You should always assume that blood and body fluids being handled are infectious. All right, scroll down. Mhm. All right, stop. The use of personal protective equipment will minimize or prevent infection and cross-infection. We spoke about cross-infection already. There are some general guidelines for you to observe in order to maintain hygiene and first and universal precaution. And that's a long list, but it's kind of simultaneous. So I don't need to go through all of that. Wear masks, keep the wound covered, wash your hands, make sure you use personal equipment, make sure you actually dispose of soiled products, right? Scroll down. Personal protective equipment, hold on. Personal protective equipment include safety glasses, hair nets, ear muff, gloves, footwear, protective clothing such as gown, and then face masks. Scroll down. Taking precautions when handling casualties, the do's and the don'ts. Okay. So keep casualty line in comfortable horizontal position. Do not move casualty more than is absolutely necessary. So though every minute you're pushing them or you're telling them get up, go over there, so no. Wear gloves and plastic wraps when and clean clothes to wipe the wound, right? Do not touch the wound with your hands or unsterile objects. Wash your hands with soap and warm water immediately after giving care. Do not wipe your eyes or face before washing hands. Wear a face or dust mask along with gloves to protect yourself from infection. Use a mouthpiece if possible, then providing rescue breathing, okay? When providing rescue breathing. So you have to be careful because the person might cough or the person might bring up infectious mucus or infectious bacteria or virus when you do the rescue breaths, right? Or assist with rescue breaths. And rescue breaths is when you use the ambo bag and like squeeze to pump air into the person's lung. When they're breathing back out the air, or the air is coming back out of the lungs, infection can be in that air, so you have to be careful. Okay. It says the casualty is if the casualty is thirsty, give him or her a wet towel to suck on. Do not give the casualty anything to eat or drink until medical personnel say it's okay. So not even water. You should give them nothing at all until the doctor comes. All right. Splint all suspected broken or dislocated bone. Do not attempt to straighten or put back in place the broken or dislocated bone. So when you're splinting something, it's not that you're trying to fix it back into place. So if you see the person leg set a certain way, you're not going to take up the leg and try to prick it back into position. Right? Everybody understand? It's not that you're clicking or cricking back the thing in position or fixing it back into position. All you're doing when you're splinting is that you're just putting something on either sides to prevent it from moving out of the position that is at now. If it move out of that position that is at now, it means that it might damage more things, damage blood vessel, break more, or dislocate more. All right? So when moving the casualty, if face down, roll the body as a whole unit, head, shoulder, and trunk, to prevent twisting and injuring the spine. You should take the back position so that you can observe any change in the patient's condition. All right, scroll down. Scroll down. Scroll down. All right, so identify hazards to the patient and carer. Hazard, something that's an object situation with the potential to cause harm, a source of danger. That's what a hazard is. All right. For you to ensure the health and safety of yourself, your care recipient, and others within the facility where you work, it is necessary that you know and apply the relevant workplace information related to one, occupational health and safety, and environmental requirements related to hazards in the workplace, obligations under relevant safety and health regulations, local medical and emergency services, provision related to roles and responsibilities of health and safety, representatives and or occupational health and safety committee. All right, so guys, as much as they hear us going through this whole heap of information, it is not that complicated, okay? They're not gonna go and ask you these big questions from this long list and say which one is this and no. No. Some simple questions. All right. And as long as we just keep on practicing, then everything will be okay. It's just that we still have to go through all of this for your benefit. Okay? Of particular importance to your proper execution of your occupational health and safety responsibilities are your institution's risk management policy and procedure, first aid procedures, safety manual and proper positioning, materials, safety procedures, procedures for the use of personal protective equipment, job procedures, and work instruction. Okay. Can scroll down. It says, if you're given care in a home setting, you should know the most accident happen there that's in home, all right? So you have to monitor the patient carefully. You have to monitor toddlers carefully and the elderly carefully. You have to check for any hazards that might cause accidents, and then now you move them out of the way, okay? It says accidents around the home usually occur as a result of water, electricity, heat or flames, toxic substances, uneven surfaces, okay? So those are some of the things that may cause you to have casualties. All right, hold on. All right. So it should have in place relevant information, policies, procedures, and equipment that are designed to protect the health and safety of everyone in the institution. That's what they're talking about in terms of occupational health and safety requirement. Okay. And some of the things that you want to look for: material safety management system, and this includes manual handling procedures. You have hazardous and dangerous substances. These would be like the handling, the storage, and the disposal of harmful chemicals, and safe operating procedures as well. All right, those are the three things that your occupational health and safety policy should include. Management of material, right? How do you handle hazardous and dangerous substance? And do you have safe operating procedure? Okay, and scroll down. Scroll down. All right. Now we're at element 3. It says assess patient and apply first aid. Okay, assessing the patient and applying first aid. When you assess the patient, it should go against the DRABC: danger, response, airway, breathing, ventilation, and circulation. That is the model that we use for our first aid. Checking for danger, checking for the response, which would be call for help. Then you have check the airway, check the breathing, check ventilation and circulation. So let's go again. Check to see if the place is safe. Check, call for help, right? Or get some form of help, response team. Check the airway, check the breathing, check the circulation, okay? Measure vital and record vital signs, right? Provide treatment for the injury, operate and apply first aid equipment, monitor the patient condition after you do the equipment, use the equipment, maintain the treatment, okay? And provide additional assistance as requested by the emergency service. And you report what happened to the administrator. Can scroll down. Okay, so let's go again. So the acronym is DRABC, DRABC. All right, that's the acronym that we use, DRABC.
Sir, how much exam question will I get?
I'm not hearing you.
How many exam questions I'm gonna get?
Well, I am not 100% sure, but I think it's like about 75, I was told.
Okay. All right. Please choose.
Called DRAB C. So if they ask you what the D stands for in DRAB, you know that it's danger, response, airway, breathing, and the C is circulation and ventilation. Right? Them don't put VC, they put C. They will be ventilation and circulation. All right. And we'll go through ABC already, which is airway, breathing, and circulation. So we don't need to go through that. I went through danger and response already. It says it's important that you assess the danger to yourself and others to ensure that there is no further injury. Okay, next. Scroll down. Check whether or not the casualty responds to your question. Can you hear me? Right? Check for unmanaged bleeding of any other injury. And then you move on to airway. Okay? Scroll down. Hello. Right. And then the airway, they check, you open the mouth, check to see if there is anything that's obstructing the passage of air. One of the things that you check for is the tongue. The tongue can actually block airway. Okay. Scroll down. And you have two things that you look for. Clear airway with casualty line on side, tilt the head backwards and lightly down, open the mouth and remove any object that is lodged in the airway, right? So you can't have the person lie flat on him back and checking the airway. Anything that is there might go down further. So you put the person on the side, you tilt the head backwards, right, and lightly down. So it's not you put the person on the back, then you tilt it backwards. You put the person on the side, then you tilt the head backwards and you pull it down a little. So while you pull down the head backwards and pull down, then now anything that's there might roll out of the mouth. Understand? And open airway. Hold on. So that's to clear the airway. You do not put your finger down the person's throat. Okay? You don't push down your finger down in them throat and trying to dig out the thing. Right? You try the maneuver first that was told to you just now. To open the airway, you do tilt the head gently back with one hand on casualty forehead and the other under the chin. You lift the jaw forward and open the mouth slightly. This is called head tilt and chin lift. Okay? In a case of suspected neck injury, you are to do the jaw thrust by placing the fingers just below the ears and lift at the angle of the jaw. And I'm going to show you those two in a video before we leave. Okay? The head tilt, chin lift, and the jaw thrust. All right? And how to clear the airway. Gonna definitely have to go through those. All right? And we already spoke about breathing already. All right? Okay, scroll back up, let me see. No, scroll right up, let me see something. Okay, good. You can go down. Right, and one of the things for breathing as well is that you listen with your ear. Listen to see if the person is breathing. Okay? You not only look, puff, rise, and fall of the chest, but you put your ear over the person's mouth to hear if they're breathing. All right? And you check for signs of circulation. And we spoke about pulse already. You check to see if it's regular or if it's an expanding. That's artery. And that's caused by the blood that is pumping from the heart. So hold on. Signs of circulation. Signs of circulation would be pulse, adequate breathing, coughing, and movement. All right. Scroll up, and you can see where the nurse is checking the child's pulse at the neck. Scroll up. 1 minute, please. Okay. All right, you can scroll down, Ryan. All right, vital signs. Signs of life measure used to check the patient's condition. And that's what we're going to do next. So after we do the one, we do an assessment, okay? Two, we do reassurance. Then we do ABC, which is airway, breathing, circulation. Then we're going to check the vital, measure, record, and report the vital signs, right? So scroll down. Can't talk about vitals anymore, but it's the key to what you do, okay? Vitals, vitals. So this is a stethoscope, and you have two areas on a stethoscope. You have the bell, you have the diaphragm. The diaphragm is the larger part and the bell is the smaller part, right? And we most times use the diaphragm, all right? So it says it's essential that you know how to accurately measure a patient's vital signs to perform effectively during a medical emergency. Vital signs are assessed to determine consciousness, elevated temperature, very high or low blood pressure, changes in pulse rate, respiratory difficulty. And then the vital signs are usually measured include, scroll down, body temperature, pulse, respiration, and blood pressure. Those are the things that we want you to focus on. Body temperature, pulse, respiration, blood pressure. Okay, scroll down. Body temperature, you know that you use a thermometer, right? What you're checking for is a fever. Okay. All right. It says in the case of an emergency, you can feel the person's forehead or the stomach or the hand, okay, to see if it feels warm to touch. Otherwise, you use a thermometer. Scroll down. Pulse. Oh, up again, sorry. For the pulse, you place your index and your middle finger on the wrist at the base of the thumb of the person. So look for the person's thumb, and then you put your index and your middle finger right below where the thumb is. So you will never make a mistake. So remember, it's not the side where your little finger is, where the person's little finger is at, that you check. Is the part where the person's thumb. So you look for the person's thumb and then you put your two fingers them right below that. Okay? Scroll down. Count on numbers of beats. So just like what you do again. So what you can do, you don't have to wait for 5 seconds. You can wait for 10 seconds, right? So you look on your watch and you see where you start 1, and then now you start count. And when you reach 10, you would know how many beats you got in 10 seconds. And if you know how many beats you got in 10 seconds, you would multiply that by 6, and you would get how many beats per minute, right? Or if you want to wait for 30 seconds, because you can't manage the 10 seconds, you wait for 30 seconds and you multiply it by 2, right? And you record your finding in rate, rhythm, and strength. So if the pulse feel weak, you say that it's weak. If the pulse feel fast, fast, right? Then you would say that it's tachycardic, bradycardic if it's too slow, right? And the rhythm, abnormal or normal. That's all you have to say for rhythm. Either it's normal or abnormal. Strength, either it's strong or it's weak. Rate would just be the number that you put, okay? And these vital signs are indicators of a patient's overall health. They reflect changes in the body. You can also check the pupils and the skin and the capillary refill. Okay, that's perfect. So scroll down. For the pupils of the person, you can assess the level of consciousness using the pupil. Covering his or her eyes for 15 seconds. Say, put your hands over the person's eyes for 15 seconds. Then, when you're gonna lift off your hand, you shine a light into the eye, and you check to see if the pupil is going to dilate, or if it remains dilated, or if it's going to get smaller. If it gets smaller, then it means that it's responding to light. If it remains dilated, it means that it's not responding to light. Okay? The pupils should contract when exposed to light and dilate when they get used to the light or the light is dim. It says capillary refill now. Press the casualties fingernail bed with your thumb and then release. Note the amount of time it takes to change back from white to red. Okay, scroll down. If it's greater than 2 seconds for it to change back to red, it means that it's a delayed capillary refill. All right? All right, stop. Provide treatment appropriate to patient's injury. Okay? So, providing treatment based on person's injury. In some cases, you may be required to resuscitate, revive casualty, while in other cases, you may need to treat common injuries such as burns, choking, bleeding, insect bites, stings, epilepsy, and other seizures, falls, and shortness of breath and fractures, right? So for burns, first aid for burns, so they go through each of them, right? So for burns, it says that for minor burns, soak in unbroken skin in cool water for 5 minutes or apply cold, wet towel to ease the pain. Do not apply ice directly to skin. This may cause further damage. So you don't put ice directly onto burn. You hold it under the cold water, the cool water, right? The running water. Or you can put a wet towel. Scroll down. Ryan, scroll. Drying. Oh, hold on. Go back up. It's a drying burnt area and applying with clean bandage. So don't rigorously scrub the person, just pat dry, or sometimes you allow it to just dry in the air. Okay. And everybody know about the running water thing already with burn. So like when you get a burn, you put your hand on the running water. Burn being covered with sterile bandage. And we know sterile bandage is like gauze. Scroll down. Scroll down. All right. It says here, look what it says. Do not apply ointment, grease, or moisturizer lotion to burnt area. These may lead to further skin damage. All right. If someone is on fire, you are to tell the person to stop, drop, and roll. Wrap casualty in thick blanket or jacket to put out the fire. Dose casualty with water and call emergency services. Do not remove burnt clothes that is stuck to the skin. You heard that? Don't pull off the clothes that is stuck to the skin. Check if the person is breathing. If not, clear airway. And if necessary, apply the EAR, and the CPR. All right. It says cover the burnt area with a dry, clean bandage, or if the area is very large, cover with a clean sheet. Do not break any blisters. So if you see, blisters, big water bumps, right? Like giant water bumps, don't burst them. These blisters help to protect the skin. Elevate the burnt area above the level of the heart. Prevent shock by laying the casualty flat, elevating his or her legs above 12 inches and keeping him or her warm. So you need to keep them warm, all right? And you need to elevate their legs. I don't know if you ever look in the movie and you see where persons who are burnt up, they put their hands up in the air and they put their legs up in the air. Did you ever think about why they did that? Nobody thought about it. It's because you need to put it above the level of the heart. The limbs have to remain above the level of the heart, and they're wrapped up like mummies to prevent water loss from the skin. Okay, and most times they try to keep them warm because they, like in an AC environment, it dries out the skin more. All right, can scroll down. Okay, where are we now? Oh, that was the next step. Scroll up, let me see. We left out anything. Okay, good. All right. Scroll up. All right, first aid for choking, the Heimlich maneuver. Everybody know about Heimlich maneuver. You see it in the movies all the time. Okay, so it's most times when persons are choking that you would do it. If blockage is severe and complete, the patient will not be able to breathe. The blood will not be able to get to the brain, heart, and other vital organs. First aid should be rendered to the patient quickly. Within at least 2 minutes, you should try to get the person to breathe again. Most episodes of choking occur during eating or playing. This is more reasons for you to ensure that the patients are properly supervised at all times. The first thing for infants under 1 year. Remember, they are unable to express themselves. So most of them will not come to you holding their throat to give you some idea that they're choking. All right? So the following things you should look for. Scroll on. So the critical signs would be one, them having shortness of breath, respiratory distress, right? Or they're weak and silent, inability to cry or speak, noisy breathing, increase in respiratory rate, and the child lips and skin are turning blue, means that they are choking, okay? Do not give abdominal thrush to an infant. This may damage the liver and other abdominal organs. They don't squeeze them belly. You don't push them belly and pump them belly to see if it will come out. That's not going to really help, okay? Scroll down. What you're supposed to do is this, so 2 things, right? Place the infant's stomach down across your forearm and give 5 forceful blows on the infant's back with the heel of the hand. Okay? You see what she's doing? So she hold him with her forehand, and the next hand with the heel of her hand, she just stroke the back of the baby. Stroke the back of the baby to see if it will come out. Okay? It says place 2 fingers of your free hand on the middle of the child's breastbone about 2 inches below the nipple and give 5 quick stroke, thrusts, right? Depressing chest almost halfway. So she have the baby almost upside down. And this time now, she put 2 fingers right below the nipple line, all right? So there's a line from one nipple to the next. Right below the nipple line, she gave 5 quick thrusts, and that would depress the chest, okay? All right. And then one, remove the object with your finger only if you can see it. If you see the object in the baby's mouth, then you take it out. If you cannot see the object, do not push your hand down the baby's throat as the first thing, as it might push it down further. Okay. All right, now we're dealing with adults, right? And we know about the Heimlich maneuver already. All right, so you do not, no, scroll up. It says, do not thrust hard enough to lift the person off his or her feet. That don't help. So, you know, you're watching the movie and it's the person literally lifting the person out off of them feet. That won't help. Okay, the person should still remain on the ground, right? Scroll down. All right. If the person is unconscious, then it's more so reassurance. It says you should only perform a finger sweep if the object is visible, okay? And you would have to call for help in this situation if the person is unconscious, right? Scroll back up. Let me see if there was anything else that was written up there. All right, scroll down. Scroll up. No, scroll down, sorry. No, scroll down, scroll down. All right, so I'm going to try and see if I could put up some videos when we're close to the end. So, all right, scroll down. Now we're at CPR, which is cardiopulmonary resuscitation. Now everybody knows about CPR already, right? All right, so it's an emergency life-saving event that we perform when somebody is not breathing. And sometimes when they don't have any heartbeat as well. And what you do, you give them rescue breaths as well as chest compression, okay? The CPR is administered slightly different, dependent on the age of the patient, right? Here are some guidelines for administering CPR. Carefully place the unconscious patient on his or her back. Open the airway and look. Remember, we spoke about the different ways in which you open the airway, the chin lift, the head till chin lift, and the jaw thrust is only if the person have damage in their spine. Okay. All right, hold on. It says, keep the chin lift and held tilted, cover the patient's mouth tightly with yours, pinch his or her nostrils shut, and give 2 slow breaths. Okay, that is when you don't have a mask, meaning that you don't have a ambo bag, is your mouth you're using, right? So that's mouth-to-mouth resuscitation. And some persons actually have a mask thing that you can put over the person's mouth to give the mouth-to-mouth resuscitation. Otherwise, if it's mouth-to-mouth, plain mouth-to-mouth, what you do the chin lift, like what was taught to you, right? And then you cover the person's mouth with your mouth and you pinch the nostril and you give 2 deep and slow breaths. Okay, so you take a deep breath and you blow, all right? And then you check for signs of circulation, breathing, coughing, or movement. And then you perform chest compression if no circulation. If you don't see any circulation, you start give the chest compression. And remember how we give, how we check for circulation is the pulse, right? Pulse, okay? Signs of movement, right? Scroll down. Okay, this picture is not the best of them all. Not sure if it's showing, right? We'll have to go through some videos. So for the infant, right? CPR for infant. All right, so for infants, the administration of rescue breaths and chest compression differs slightly from that of young children and adults. The steps in carrying out the cardiopulmonary resuscitation. Scroll down. So step 1, hold on, go back up. So step 1, do the halting chin lift, and then you look and listen for breathing. All right. Step 2, scroll down. Step 2, put your hand in the center of the child's chest. Put one hand, right? Between the nipples, that's the nipple line. Push down 15 times and continue with 2 breaths. Then 15 pushes until medical help arrives or the person starts breathing, okay? So you do 15 pushes, and then you give them 2 breaths. And you go 15 pushes again, and then you give them 2 breaths. And you do this until the emergency team arrives, or if the person start breathing again, then fine, you can stop. Okay? Scroll down. Scroll down. So first aid for insect bites and sting. Scroll up a little. Scroll up. Okay. All right, so first aid for insect bite and stings, right? The general steps for treating most insect bites and stings, including those from bees and the others. So remove the stinger. Everybody know about the stinger already, right? It's a piece of the piece of the bug where the toxic substance came from. Sometimes it break off and leave in the skin. And you can literally see the piece of stinger in the skin, right? What you're supposed to do it is supposed to use like a scraper to remove it, okay? And you use like a phone card. You can use a phone card, like a credit card or something, and you scrape it out, okay? After you sterilize it, that is. It says wash the area clean with soap and water. Place ice wrapped in towel on the sting for 10 minutes to slow absorption of the venom or poison and relieve the pain, and then remove for 10 minutes, then repeat. If necessary, give antihistamines such as DPH elixir, right, to prevent or reduce the severity of the allergic reaction, and you can also give painkillers, okay? All right, scroll down. So there is that person using the phone card to scrape out the stinger out of the phone card or the debit card or the whatever card you want to use, to scrape out the stinger out of the person's skin. Okay? Scroll up. First aid for bleeding. Okay? First aid is used for external bleeding. If there are signs of internal bleeding or shock, you must call emergency medical services immediately. Blood coming from a wound usually stops within 5 to 10 minutes with proper first aid. Okay? All right. So and remember shock. What are some of the signs of shock? If the person's blood pressure is going low, if the person start feel dizzy and talking about they feeling like they're gonna block out, and if their pulse is weak, that's a sign of shock. Okay? So to stop bleeding, step one, stop bleeding by applying pressure to bleeding site and with sterile cloth. Okay? So you put a sterile cloth on it and you press. Okay? When you press and hold on it, they use a bandage to wrap around the sterile gauze or the sterile material that you're using. Okay? You apply the bandage, they wrap the bandage around it. Okay? To continuously give the pressure. And go down, scroll down. Go up. Okay, so what is the management? Scroll up, let me see. What is the management that is recommended for a minor and a major bleed? So the most thing that you want to do is to try and stop the bleeding, right? So you compress, 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 compress. Okay. The minor bleeding will stop after a few minutes, as was said before. The major bleeding, you may have to apply the bandage and apply pressure, and you have to alert the emergency department as quickly as possible. Okay. How would you handle an amputated limb? Meaning the limb completely severed off, and you're there alone? Try to stop the blood vessel from bleeding. So what you would do, you would use like a belt, or you would use some form of band to tie above the amputation. So take for instance, you're there and somebody was in an accident and their entire leg got torn off. You would tie like a belt or like a rubber, like a extension cord, something that would keep some form of resistance. You would tie it above the wound, okay? And that should stop it from bleeding until you bring the person to the hospital, all right? Our first aid seizures, all right? First aid for seizures, convulsions, epilepsies, or fits. Seizures, also known as fits, epilepsy, and convulsion, is a medical condition which has multiple causes. It involves some disruption of brain function and may result in partial or total loss of consciousness. In children, it is often caused by extremely high fever. The symptoms of are like a blank stare, unresponsiveness, violent, uncontrollably, shaking of the body, and possible wetting of themselves, meaning that they pass urine on themselves or they pass feces on themselves. There's a high risk of the patient falling and causing serious injury to him or herself. So you have to help. When somebody is in seizure, you don't just leave them like that, but they can go and hit them head and burst them head. Them can drop on a stone, them can drop on a sharp equipment and kill themselves. So you have to be careful how you handle somebody that has a seizure. It says your main task is to prevent the patient from hurting him or herself. Here are some useful pictorial illustrations on how to provide care. Scroll down. So the person is there, person is having a seizure. It says illustration of patient having a fit, prevent the patient from falling. So if you see the person started having the fit, While standing, don't let them drop to the floor, okay? Catch them, right? Don't be scared of them. Catch them, hold them, right? And then you gently put them to the ground, okay? Okay? To prevent them from falling. Lay the child on the floor on a cushion on the back of the head, right? All right, scroll down. Scroll down. Okay. You loosen the tight clothing for the patient. Scroll down. Scroll down. All right, something was missing there. Now, you see persons who have fits and seizures and stuff, you don't want them to lie flat on their back, okay? You put them on the side, right? Because if you put them on the back, they might have substances in their mouth, or they might be vomiting up substances, and because they're on their back, it might go down into their lungs. They put them, you roll them to the side, and you hold them on the side until the seizure stops. Like in case anything is coming out of the mouth, it will roll out. Just like when we were discussing the foreign object in the mouth, right? Okay, scroll down. All right, first aid for shortness of breath. Difficulty in breathing may be the result of any of the following conditions: choking, chest or neck wound, a panic attack, or asthmatic attack. Scroll down. It says the signs and symptoms include rapid shallow respirations, breathing, pulse exceeding 120 beats per minute, difficulty breathing such as slow, irregular, or noisy breathing, or fighting to breathe, coughing, fatigue, inability to talk without catching breath. And if there is an open wound in the chest, close to the, close to, or close it to prevent air entry in the lungs. Because when you have air entry in the lungs, you won't be able to breathe, right? It's called a pneumothorax. It's a big word, but when you have a pneumothorax, it's air getting into the lungs from outside, and that can cause you to have difficulty breathing. So you have to be very, very careful. Okay, so these are some of the signs and symptoms for persons who are having difficulty breathing, right? All right, scroll down. Yeah, Ryan, can scroll. Okay. So the guidelines for dealing, oh, go up, go up, go up. So it says the guidelines for dealing with difficulty breathing, all right? Below have one that is incorrect. Which is it? They're saying that we should state which one of these is considered incorrect. So call emergency services immediately, yes. Check airway breathing and circulation, yes. Monitor vital signs before every 40 minutes. Loosen tight fitting clothing. Help the patient to use any prescribed medication or equipment such as asthmatic inhalers and nebulizer. If still conscious, position the child so that he or she can breathe with the least amount of effort or distress. Most find sitting upright comfortable, which allows for adequate lung expansion. Be calm and keep the child calm until help arrives or until you get the emergency department of a medical facility. What would you say about somebody with difficulty breathing? Which one of these you think would be wrong? Anybody?
Maybe monitor vital signs every 40 minutes.
Right. It would be shorter, right? But everything else is good. But 40 minutes is a long period for you to be checking the vitals. But remember, the person is an emergency, right? All right, scroll down. Oh, First aid for falls. The first aid for falls. So falls may cause minor bumps and bruises as well as major injuries such as fractures that will need immediate medical attention. Infants, children, and older patients may be injured by fall from the following sources: climbing out of bed, swinging and back out.
Hello, Dr. Tracy?
Yes, you're hearing me?
Hello?
Yes, Prudence.
Could you say what the answer was for the question that you asked earlier? We were unable to hear because our Wi-Fi is in and out.
Oh,
Thank you.
You're monitoring the vitals every 40 minutes. That one is wrong.
Okay, thank you so much.
Yeah, man, no problem. All right. Where was it? Right. So some of the ways that you can get injury is climbing out of bed, sink and bathtub,
Sorry
descending.
to butt in again, sir.
I'm not hearing you. Go again.
Sorry to butt in again, but could you say how often should check vital signs should we check?
I would say every 15 minutes would be a good option. To be honest.
Thank you.
Yeah, man. Every 15 minutes would be good, but 40 minutes is a bit long. Because remember, the person isn't breathing. So it would, and it's in some cases, you would probably want it to be continuous, right? Meaning you would have the person on a machine that would be checking their oxygen level, pulse rate, all of that continuously, right? Maybe the respiratory rate is not every time every gonna be just one straight thing, but you could check it every 10 to 15 minutes. But for it to be 40 minutes is it's a bit long. I understand? All right. Where are we now? All right. So we spoke about the different ways in which you can get injury. It says, do not move the patient. When somebody falls from a tree, falls from a height, don't move the patient. You call emergency medical services. Okay? If the person has suffered serious injury to the neck, the head, the hip, the thigh, don't move the patient because you may make it worse, right? Is unconscious and not breathing, then you start CPR. Has difficulty breathing or is having a seizure, has clear fluid or blood oozing from the nose and the mouth, you have to call emergency, right? Will not stop crying, that's for babies, exhibit strange behaviors like irritability, is falling into a trance like sleep, is not focusing, vomiting more than 2 times, right, after a fall, is a sign that you might have brain damage, complaints of neck and back or increase in pain, or walk with a limp, that is a sign that you might have a fracture, right? Or you might have a spinal injury, okay? Scroll down. Okay, so first aid for fractures and sprain. A fracture is a broken bone. In the common closed fracture, the skin is not cut. So when the skin is not cut, it's called a closed fracture. When the skin is open and you see in the bone, it is called an open fracture, right? The signs and symptoms include deformity. So you literally can see where the leg look deformed, like it swing out so, or it bend over so, or something. That is a sign that it's broken, right? Pain and tenderness, swelling and discoloration, and you can't use it, okay? Loss of use. You should make the following checks. Determine what happened and location of the injury. Hold on. So you determine what happened and the location and the injury. Do not move the patient unless necessary, right? So take for instance, if something dangerous coming, either fire, or this is like a chemical leaking coming towards the patient, then you definitely have to take up the person, right? Observe the color, temperature, and pulse of the leg. If there is no pulse, then you have to call an emergency. It's an emergency if you're not feeling no pulse in the leg. And what is going to happen is that the blood supply is going to cut off, and then the leg can go dead, and they may lose their leg, right? Control the bleeding if noticeably and treat for shock. When we say treat for shock, meaning the blood pressure very low, the pulse very weak, and you can't feel the pulse, then you need to get the patient straight to the hospital as quickly as possible so they can put them on drip, right? But the main thing is to make sure that the bleeding stops, right? Just cover the wound if necessary and splint all fractures, okay? Keep all fingers and toes exposed to check for circulation. All right, materials such as pillows, cardboards, and newspapers and blanket may be used as splints, okay? Scroll down, sorry. If spinal injury is suspected, it is best to wait until trained personnel with proper equipment arrive, offer the necessary reassurance. That is if spinal injury, and spinal injury is like severe pain in the back, severe pain in the neck. Don't move the patient when they're complaining about that, like they can't move the neck and they can't move the back and they can't sit up, because you might go move them, and as them get up, the neck just collapse and then they just die. Okay, right in your hand. As you lift them up, them just dead, because the spinal cord was, the column was broken, and then when you move them now, you literally cause the spinal cord to get compressed, and then they instantly die. So you just leave them like that until somebody come with a backboard to take them up, all right? Making an arm sling. An arm sling is used to secure sprained, dislocated, or broken arm before you carry a casualty to the doctor. Drape a piece of cloth under one arm and the other end over the opposite shoulder behind the neck. Pin the remaining elbow corner and secure the arm to the body with a strap. So I need to send you a video with arm sling, all right? Arm sling. I'll send you that as well. Scroll down quickly. And this is the arm sling that was made for this child. Scroll down. Then scroll. Making a hand splint. Or you can scroll down, Amran. Hello? Okay. So for the splint now. Oh, look up, let me see. So you making a hand splint. This is used for crushed fingers. So what happened, you want to protect the fingers, right? So you put a rolled up sock or a soft ball in the hand, and put the fingers them over the soft ball, right? And then you're gonna wrap the fingers and the hand over the soft ball. So scroll down. Right. So you see, they literally wrap the fingers and the hand into the soft ball. You see they're rolling over the bandage over the hand. Scroll down. And they use tape to anchor it down so that it don't fall out and it don't loose. Can scroll down. And that's the finished product there. All right, scroll down. Operate and apply first aid equipment. Okay, there are several items of equipment that may be used in an emergency situation. Your choice of equipment will be influenced by the type of emergency and the nature and extent of injury sustained by persons. In addition to the basic items listed in element 1, other first aid equipment that is used during a medical emergency include stretcher, thermometers, sphygmometers, stethoscope, mouth protective devices. And you should only use the first aid equipment if you are trained and allowed to do so. So don't do it unless you're instructed, okay? Scroll up. All right. It's always best to have your supervisor and authorized personnel to demonstrate the use of the equipment before an emergency arrives. So the use of the sphygmometer, scroll down. It's an instrument for measuring the blood pressure, and we already go through that already. So we don't need to go through blood pressure and stethoscope. You can scroll down. Scroll down. And we know about the manual blood pressure machine already, so that's fine. Can scroll down. That's blood pressure machine again. Scroll down. This is the one that we use, right? Everybody remember how to use this? Scroll down. Okay. Right. And you can just read over those about blood pressure. Scroll down. It's just some more about blood pressure. We went through these already. All right, guys. Just look over the videos about blood pressure. Scroll down. Scroll down. Oh, stop. Hold on. All right. Monitor patient's condition. It was discussed earlier that after applying first aid to stabilize and resuscitate an injured person, it will be necessary for you to monitor the patient, the individual's vital signs, and report your findings to the medical personnel when they arrive. It is necessary to check the signs for serious injury or complications that take the necessary corrective action before emergency medical assistance arrives. Even in the event that such medical assistance was not summoned immediately or after release from care, the recovering casualty needs to be monitored and the doctor contacted as necessary. The following conditions require specific measures. Scroll down. All right, 1. So insect bite. You check for breathing, facial swelling, and the strength, right, of the limb. Seizures, the behavior after the seizure, medical, if there is any further seizures, those are
Hello?
Yes, right, we're here. Not hearing Dr. Tracy though.
Right, I was just lost him along the way.
Oh, okay. You hear me now?
I can hear you now.
Okay, where did I stop?
You started from the very top of the table where it says condition about insects, bite, and stings.
All
That's
right.
where I last heard.
Those are the things that you monitor. So while you're treating the person, while you're waiting to see if the person will deteriorate, these are the things that you check for. You check the breathing, you see if they're getting facial swelling and if there's decrease in strength. And then for seizures, you check if they're gonna have, if there is any further seizures, you check for that, you check their behavior. And the shortness of breath, you check for coughing, you check the vital signs, the respiratory rate to check if it's rapid, and the skin color, and if their mental state is abnormal. And provide further assistance if requested. So you can volunteer history of medical condition of the patient from the emergency contact sheet. You can volunteer contacts, so telephone numbers and address of next of kin, provide paramedic assistance and accompany patient to the hospital if necessary. You can also monitor and treat home-based patients, carefully following instructions of the medical personnel, and immediately report any changes in patient's condition. All right, roll on. All right, and this is a sample of a first aid report. All right, and why do we, the report? It's a provide an oral report immediately after the patient has been stabilized and or responsibilities of the patient's medical care has been assumed by emergency medical personnel. So remember, you're going to hand over the patient now to the emergency medical. So you need to give them a report, right? And you also submit a written report within 24 hours of administering first aid with the information below. Scroll down. And that's the report there. All right. After you tell them what happened and you tell them what you did, then you write this up and you give it to them. Okay, within a 20. Right. That's it. Right?
No, that's it.
Right. So that's all for
Ryan? Ryan?
Can you hear me?
Hearing you now.
Yeah, so we're at the end of the PowerPoint, but I'm not hearing Dr. Tracy anymore. Dr. Tracy?
hello.
Dr. Tracy, can you hear us now?
Yeah, man, I'm hearing you. Okay. All right. I hope this kind of helped you to go through the material on your own. It should make it easier because we scan through everything. So when you're reading back through, you shouldn't have much difficulty. Okay. Is there any concerns that we have? Any questions? No? All right, for the paper that was went through, Ryan sent me the video and I posted it in the group where Nurse Smith went through the past paper. Okay. How are the questions so far? Persons, are you guys printing off the papers? Hello, are you guys hearing me?
Yes, Dr. Tracy.
Okay, I was saying for the past papers, are you guys printing them off and storing them? And
Sure.
huh?
Yes, that's what I did. Yes, that's what I did. I printed them off.
Yeah, man, just form a folder and ensure all of them you have the answers to them. Okay, you have the answer. I had sent the one that we had discussed with the elderly. I had sent that in the group. I'm not sure if everybody saw it with the confirmed answers. There is no learner guide on that. So yeah, there's no learner guide on that topic. So you have to use that the answers that were submitted. Okay. There's a past paper that she had posted in the group for you guys to have to go through. Do you guys get a chance to go through it?
I didn't get a time to go through it, but I'll do so tomorrow.
Okay, okay, no problem. So I'm gonna do for the few minutes that we have until 8. I'm just gonna bring up some videos. Ryan, I'm gonna send it to you via email, okay? And then you just pull up the videos, okay?
No problem.
All right, I'm gonna send it to you, Ryan. Ryan, I'm seeing 2 emails for you. One that says Ryan 22 and another one.
Oh, you can send it to the 22.
Okay. I'm sending the first one, which is a splinting. All right, you can put it on full screen.
Oh, okay, everybody can hear everything?
I don't think they're hearing because I'm not really hearing. You'd have to put it play it from your phone. You'd have to exit the Zoom from one of your device, which is your phone, and you would have to play the video from your phone simultaneously with the video on the computer.
Okay, no problem. 1 second.
Yeah, you turned up the volume on your phone. It is slow. All right, what I'm gonna do, guys, I'm going to try and see if I could just forward all the videos in the group, and you guys just go through them, please. Okay. But when you're splinting basically anything that is rigid enough, you would use to stabilize a cardboard, right? Towel, sheet, anything that you can roll up and use to splint the leg. This is all right, Ryan. So what I'm gonna do, I'm going to send the video to everybody in the group. Is there any questions that anybody has? Any concerns so far? how is the pace in terms of the session? Is anybody falling off track? Anything? Then let me know. Hello? Kimisha? Miss Murdoch? Hello? Kimisha? All right, so Kimisha not answering. Andrea? Andrea? All right. Everybody's silent. Hello?
Yes, Dr. Tracy.
Yes, correct. I was just checking, how are the preparations for the exam going on your end?
All right, so from my end, it's not very good because I just have to basically pushing to find the time. It's overwhelming, but I'm trying my best.
Okay. The thing is, I believe you guys are kind of thinking that this is some big scary event. It's not that bad. Okay.
No, I'm not thinking it's a big scary event. It's just really getting the time. I mean, sometimes I try to read and I'm basically falling asleep because I'm extremely tired. So it's basically getting the time to just go over the content so I can be more aware.
Right. So what I would say at this point in time, right? Because we got the material and everything kind of late, right? At this point in time, we're using the strategy whereby we're going to cover majority of what needs to be done through the practice papers that we're getting. Okay. While we're doing that, we're going to be going through the learner guide. Apparently, there is nothing else needed to go through except the learner guide.
Okay.
Right? So you don't need to go and do this whole big research and these whole textbook, nothing else. All right.
Okay, that's it.
As long as you follow it.
I was asking if the exam will be multiple choice.
Yes, it's a straight multiple choice.
Okay.
But we just do the short answers because we want you to get a good understanding.
Understand. Did you get the pass mark grade?
No, I only saw the deadline, but I believe the standard is 50, right?
Okay.
All right.
Was anybody able to hear the video?
No, Ryan. No, we weren't hearing it.
But I sent all of them to you. Could you forward every one of them to the group, please?
Not a problem.
Yeah, man. Send it to the group. And just what you do, just ensure that you print off the practice paper. Okay? Print off the practice paper. While we're still kind of solidifying everything and make sure that you know what you're supposed to know at the end of the program so that you're efficient as a medical assistant, because we're still going to go through all of the information, right? But at the end of the day, we want you to pass the exam, right? So just ensure that you just print off all the practice papers that we give and ensure that you have the answers to them as well, all right?
Okay, sure.
Yeah, no problem. All right. So I sent another learner guide in the group. Some of them I'm gonna ask that you go through it on your own. okay? Because there isn't much need for me to go through them. Like the stock, we already went through a practice paper on the maintenance of stock. So it's basically like a little revision for you to read through. And it's just 35 pages, right? And remember, you're reading through. You're not, you're not, you're not memorizing anything. You're just reading through. Okay, guys? Because when you try to memorize everything word for word, that makes your life difficult. And you're not really learning when you do that. So you just do one straight read through, like you're reading a book, okay? Until you reach the end. And what you can do while you're reading through, you can just use a highlight and just highlight little points where would maybe come as a question. That's all right? So for this stock, I'm gonna ask that you go through maintenance of stock, and for sanitation and hydration and hygiene care, you're supposed to read through that one on your own. All right? Those are self-explanatory. I don't see a reason for us to really have to go through those. But the ones that we're definitely going to have to go through, I'm going to be putting on the I'm going to go through them with you. All right. All right. So I believe that's it for today. Ryan, post the videos, please, so that everybody can get an idea of what we did. So arm sling is one of the videos, CPR in infants, Heimlich maneuver, opening the airway, and splinting. All three of those, all those videos they should go through. And remember the project as well. Remember the project, try to get that out of the way from early, okay? And send the videos to us so that we can submit it to her so we can get the project out of the way. All right?
Okay, sure.
All right, no problem. All right, take care, everybody. Bye.
All right, Dr. Tracy, before you go. All right, so I have the video recording setting. It's there and it's active. And I set it to record to the cloud. It just automatically goes to the cloud after we end the meeting.
Yeah, man, it's going to automatically go to the cloud.
Okay, not a problem.
Mhm.
All right. All right.